Miss S. My name is Brooke Sadler.
Hi, it's nice to meet you.
I'm a nursing student at Texas State, and I'm currently in their family nurse practitioner program. Today, I will be going over why you came in today and just getting a medical history on you, okay? So if you could tell me what the main concern is that brought you in today.
My throat's been hurting for the past 2 or 3 days, and then today I woke up and it was hurting when I was swallowing. It was really sharp pain, so I just wanted to come in and see if I was sick with anything.
Okay, have you been in contact with anyone who's been sick lately?
My roommate actually, she had strep throat about 5 days ago, so I wanted to make sure it wasn't that, or if it was, to get medicine.
Okay. And then if you could just tell me about yourself, just kind of what you do for a living, and then after that, if you could give me a medical history.
Okay. So I do marketing for a website. I work from home, do a little recruiting as well. Just graduated college in 2012 doing PR and advertising, and now I'm doing marketing. So it's kind of cool to learn something different. I was diagnosed with generalized anxiety disorder. I take Zoloft 100 milligrams a day. I've been taking that since the summer of 2008. And I also, I had mono in college in 2012. And I had, my tonsils were so large that after they got better, I had cryptic tonsils because they were so inflamed. And so that kind of makes me anxious too, with all of, being sick, and then my throat's hurting, and then I already have to deal with that. But I did go to an ENT to see what I should do about them, and he said I should get my tonsils removed, and I haven't made an appointment yet just because I've never had a major surgery like that. The only other surgery I've had is getting my wisdom teeth out. So it just makes me nervous, going under the knife and whatever, and having anesthesia. So I just haven't made an appointment yet for that.
That's definitely understandable. I can see how that would make you more anxious, or anyone anxious, if that's your first time going under.
Yeah.
So you do have the cryptic tonsils, and you do have generalized anxiety, and you had your wisdom teeth removed. Is there any other past medical history on you?
No, I had the chicken pox when I was young, but nothing major.
Okay. If you wouldn't mind just giving me a family history, just kind of over your immediate family, such as your mother, father, and then their parents, just any diseases or any medical issues that they had.
Okay. My mom, she has anxiety as well, and I think she takes Lexapro for that. She has high cholesterol, but she's not taking anything for it. My dad had a heart attack in 2000, and he has high blood pressure and high cholesterol, and he's taking medicine for that. And actually, he just was diagnosed with diabetes like 6 months or a year ago, so he's dealing with that as well. And he actually had polio twice growing up.
Wow.
Yeah. And so now he has like post-polio myelitis, where just his whole leg is just being eaten away by the polio that came back 50 years later. And then my mom's mom had breast cancer twice in the 80s, and then she passed away from it when it came back in 2007. And then my mom's dad, he had a stroke and just was like 86 and living in a nursing home, and kind of was getting dementia. And then my dad's mom and dad, his dad passed away of a massive heart attack, and then his mom passed away from a stroke.
Okay.
Yeah, but I don't know anything else about them before.
Okay. All right. I just kind of wanted to go over and make sure if you're having anything out of the ordinary going on with you, just kind of get what your baseline is. So as far as your throat's going, have you had any discharge or mucus that you've noticed at all?
No.
Any white patches on your tonsils?
Not that I've noticed.
Okay.
It's just really sharp pain, like really sore.
Yeah, I just asked that because sometimes that can be an indicative of strep throat, and I know since your roommate had that.
Yeah.
So when you're swallowing, you said it's a sharp pain. And then can you rate that pain for me on a scale of 0 to 10, 0 being no pain, 10 being worst pain you ever felt in your life?
I would say about 6.
6?
Yeah.
Okay. And then is the pain worse at any point in time during the day, or anything causes it to be worse, or anything causes it to feel better?
In the morning, it's kind of more intense, probably just because I haven't had any water or anything after I slept. But I've been taking some throat lozenges and some Dayquil and NyQuil just to get the symptoms, out. But the throat lozenges have been helping in some. So.
Okay, good. All right. And as far as breathing, I know you said it's difficult to swallow, but are you having any respiratory issues, any breathing issues? Is it difficult for you to breathe, or is it just strictly when you're swallowing?
It's just my tonsils when I'm swallowing. I'm not having any congestion or like breathing problems. It doesn't hurt when I breathe or anything.
Okay, and then as far as your bowel movements go, are those still normal? Have you had anything change with that?
And everything's fine.
Okay, and can you kind of give me a baseline for you what is normal? I know some people, they can go once every 3 days, and some people have a regular bowel movement every day. So what's your normal?
I'd probably say like once every 2 days.
Okay. And then as far as your last menstrual cycle, can you tell me when that was?
It ended on January 4th.
And are those pretty regular? Do you have to take any prescriptions for those?
I was taking birth control for a while just because I do get really bad cramps and I was getting acne on my face.
Mm-hmm.
But I just stopped. I ran out of them.
Okay.
and my face has been clearing up, so I kind of just wanted to just see if I could get off of that.
Okay.
But
so you're interested in stopping that and not restarting?
yes.
Okay. Well, if you do ever decide you want to look at birth control again, if you have any questions, feel free to ask. Okay.
Okay.
Let's see. As far as bladder is concerned, any change in urine output, any burning, stinging, anything like that you've noticed?
No, it's normal. I guess.
Normal?
Yeah.
Okay. Muscle-wise, are you having any aches, any pains, anything like that that's happened, or?
Just a little achy from my throat hurting,
Okay.
but nothing else major.
Can you describe where the achiness is?
Just kind of overall feeling of just blah.
Is it worse at any point in time during the day, or is it pretty consistent?
It's pretty consistent. Yeah.
Okay. So you said we're having difficulty swallowing and a sore throat. So do you have any allergies that you know of? Any food or drugs or anything that you're allergic to?
No, I'm not allergic to anything.
No. Okay. And have you received the flu shot for this season?
No.
Were you interested in receiving that?
No, I was thinking about it, but I've never had one before, so I don't know if I need one right now. A lot of people I know have gotten the flu shot and then have gotten the flu, so I don't know if it's even worth getting it.
Okay.
Yeah.
Well, if you have any questions or if you do want to explore that, please let me know. We have informational handouts we can give you, or I could discuss that with you, okay?
Okay, great.
All right, Miss S, after going over your current symptoms, I would like to do a strep test on you. We'll just kind of get a Q-tip and swab your throat, and we'll run that. And then we just really need to start pushing fluids and making sure you're staying hydrated, and that will help. But whenever we run that test, we'll have some answers, and I'll get back to you, okay?
Okay.
It was really nice meeting you, and I'll be back shortly.
Thank you.